COVID-19 is a respiratory disease. Look at this picture. Coronavirus and chest X-ray. Look at this. Normal, pneumonia, and COVID-19 findings. Look at this. Then CT scan findings. Detail going on. Introduction. COVID-19 is an infectious disease caused by the novel coronavirus SARS-CoV-2. Severe acute respiratory syndrome coronavirus 2, first identified in Wuhan, China in late 2019. COVID-19 rapidly spread worldwide, leading to global pandemic. The virus primarily affects the respiratory system, but can have wide ranges effects on multiple organs and systems in the body. COVID-19 has become a major global health concern, causing significant morbidity, mortality, and economic disruptions. Etymology. The term COVID-19 is an acronym derived from corona, VI, virus, D, disease, and 19, the year it was discovered, 2019. The name refers to the novel coronavirus disease that was first identified in December 2019. Corona itself is from the Latin word corona, meaning crown, describing the appearance of the virus particles which have a crown like structure due to spikes proteins on their surface. Definition. COVID-19 refers to the disease caused by the SARS-CoV-2 virus, characterized by symptoms ranging from mild respiratory illness to severe respiratory distress syndrome and multi-organ failure. It primarily spreads through respiratory droplets when an infected person coughs, sneezes, or talks. Types. 1. Asymptomatic COVID-19. Infected individuals show no symptoms but can still spread the virus. 2. Mild COVID-19. Symptoms are mild, such as fever, cough, and fatigue, and often resolve without medical intervention. 3. Moderate COVID-19 individuals experience more pronounced symptoms such as shortness of breath, cough, and chest discomfort. 4. Severe COVID-19. Severe symptoms such as acute respiratory distress syndrome, ARDS, hypoxia, low oxygen levels, or multi-organ failure. These cases require intensive medical care. 5. Critical COVID-19, characterized by multi-organ failure, septic shock, or the need for mechanical ventilation. It is life threatening and requires urgent medical attention. Causes: COVID-19 is caused by the SARS CoV 2 virus, which is a novel coronavirus that primarily targets human respiratory cells. The virus spread through 1. Direct respiratory droplets released when an infected person coughs, sneezes, or talks. 2. Fomites, contaminated surfaces that can transfer the virus when touched. 3. Aerosol transmission, smaller droplets that remain airborne for longer periods, especially in poorly ventilated spaces. Transmission. Transmission of COVID-19 primarily occurs through following routes. 1. Person to person via respiratory droplets. The virus spread when an infected person coughs, sneezes, talks, or breathes, releasing respiratory droplets that can be inhaled by people nearby. This is the primary mode of transmission, particularly in close contact setting. 2. Aerosol transmission. In certain situations, especially in poorly ventilated indoor areas, smaller droplets, aerosols, can remain suspended in the air for longer periods. These can be inhaled by individuals, even if they are not directly near the infected person. 3. Fomit transmission. The virus can also survive on surface for varying lengths of time depending on the material, and people can contact COVID-19 by touching contaminated surface and then touching their mouth, nose or eyes. 4. Close contact. Physical contact with an infected person, such as shaking hands or hugging, can facilitate transmission, particularly if an individual touches their face after contact. 5. Vertical transmission. Although rare, there is evidence of possible transmission of the virus from a pregnant woman to their fetus during pregnancy, birth, or breastfeeding. Risk factors: 1. Older age. Adult over the age of 60 are more likely to experience severe symptoms. 2. Pre existing medical conditions. Individuals with conditions such as hypertension, diabetes, cardiovascular diseases, chronic respiratory disease, and obesity are at increased risk. 3. Immune system suppression. People with compromised immune system, such as those undergoing chemotherapy or those with autoimmune disease, are more vulnerable. 4. Smoking. Smokers are at high risk for severe respiratory complications. 5. Pregnancy. Pregnant women may be at increased risk of severe illness. 6. Living in congregate setting. Individuals in close contact environment, such as nursing homes or prisons, are at high risk. Complications. COVID-19 can be lead to over complications, particularly in individuals with underlying health conditions. The complications include: 1. Acute respiratory distress syndromes ARDS, severe lung injury leading to respiratory failure. 2. Pneumonia, infection causing inflammation and fluid in the lungs. 3. Multi-organ failure. In severe cases, the virus can affect the heart, kidney, liver, and other organs. 4. Thromboembolism, blood clots that can lead to stroke, pulmonary embolism, or deep vein thrombosis. 5. Long COVID post-acute sequel of SARS CoV-2 infection, persistent symptoms such as fatigue, brain fog, and shortness of breath that can last for months after recovery from the acute illness. Pathophysiology. The pathophysiology of COVID-19 caused by the SARS CoV-2 virus involves a series of steps that lead to viral entry, immune response, and potential complications. Below is a step by step breakdown of the process. 1. Viral entry. Transmission. Binding to ACE2 receptors. Endocytosis. 2. Replication and spread. viral replication, assembly and release. 3. Host immune response, innate immune response, inflammatory response, adaptive immune response. 4. Cytokine storm. In severe cases, excessive inflammation, multiple organ involvement. 5. Respiratory complications, pneumonia, acute respiratory distress syndromes, hypoxia. 6. Symptomatic effects, coagulation, abnormalities, multi organ damage, endothelial dysfunction. SARS-CoV-2 can damage the endothelial cells lining blood vessels, which disrupts blood flow, increases the risk of clotting, and causes vascular leakage, leading to fluid buildup in the lungs and other tissues. 7. Recovery or long COVID-19. Resolution of infection. In many cases, the immune system clears the virus and the patient begins to recover. However, the inflammatory damage caused during the infection can result in long term health issues even after the virus is cleared. Long COVID, some individuals, especially those with severe disease, may experience persistent symptoms such as fatigue, shortness of breath, cognitive dysfunction, brain fog, joint pain, and other issues for months after recovery from the acute infection. The pathophysiology of COVID-19 involves a complex interaction between the virus and the host immune system. While many people recover without severe symptoms, others experience significant complications, particularly in case of severe infections. The body's immune response is essential in controlling the virus. But when it becomes excessive or dysregulated, it can lead to widespread organ damage and severe outcomes. Signs and symptoms. Common symptoms: fever or chillness, cough, fatigue, shortness of breath or difficulty breathing, sore throat, loss of taste or smell, muscle or body ache, headache, runny nose, nausea or vomiting, diarrhea. Severe symptoms requiring immediate medical attention: 1. Difficulty breathing, 2. Chest pain or pressure, 3. Confusion or inability to stay away, 4. Burst lips or face, sign of hypoxia, Diagnosis 1. RT-PCR, reverse transcriptase polymerase chain reaction, the gold standard diagnostic test for COVID-19, detecting viral RNA, nasopharyngeal swabs. 2. Antigen tests, rapid tests that detect viral proteins, typically used for quick screening. 3. CT scan or chest X-ray imaging may reversal pneumonia, lung damage, or signs of ARDS. 4. Blood test to assess inflammation, example elevated C reactive protein, liver and kidney function, and other markers of disease. Severity. 5. Antibody test detect previous infection but are not used for diagnosing active infection. Nursing diagnosis 1. Ineffective airway clearance related to respiratory secretions and inflammation. 2. Impair gas exchange related to pneumonia or ARDS. 3. Risk for infection transmission related to the communicable nature of the virus. 4. Acute intolerance related to fatigue, weakness, and shortness of breath. 5. Anxiety related to uncertainty, fear of disease progression, and social isolation. Management, medical management. 1. Oxygen therapy for patient with low oxygen level, hypoxia to improve oxygenation. 2. Antiviral medications like remdesivir or molnupiravir may be used to inhibit viral replication in certain cases. 3. Steroids dexamethasone is commonly used in severe cases to reduce inflammation and prevent cytokine storms. 4. Monoclonal antibodies used in early stage infection to reduce the severity of symptoms. 5. Blood thinners to prevent thromboembolism complications. 6. Ventilation, mechanical ventilation or non invasive ventilation, example CPAP or BIPAP, may be required in severe cases of respiratory failure. Nursing management 1. Monitoring vital signs continuously. Monitor oxygen saturation, respiratory rate, heart rate, and blood pressure. 2. Positioning. Position patients with COVID-19 prone on their stomach. If they are experiencing severe respiratory distress, as This can improve oxygenation. 3. Hydration and nutrition. Ensure adequate hydration and nutrition, especially in patients with difficulty eating due to illness. 4. Psychosocial support. Provide emotional support and reduce anxiety about illness, progression, or isolation. 5. Education. Educate patients about self care, isolation protocols, and the importance of completing prescribed treatments. Treatment options. First option, oxygen therapy for patients with hypoxia or difficulty breathing. 2. Antiviral treatments. Remdesivir or other antiviral drugs may be prescribed for severe cases. 3. Steroid use. Dexamethasone for patients with moderate to severe disease. 4. Anticoagulation therapy to reduce the risk of blood clot formation. 5. Monoclonal antibodies in high risk patients. Those may be used to reduce the severity of the disease. 6. Supportive care, including mechanical ventilation or non invasive respiratory support in critical cases. Psychosocial medicine. 1. Psychological support. Provide counseling to alleviate anxiety, stress, depression due to isolation or uncertainty about the disease. 2. Communications. Maintain clear communication with patient about their condition, treatment plans, and expected outcomes to reduce fear and confusion. 3. Social support. Facilitate virtual connection with family members or support groups to reduce feeling of isolation. 4. Mindfulness techniques. Encourage relaxation methods such as deep breathing or guided imagery to manage stress and anxiety. 5. Post discharge care. Provide follow up services to monitor mental health and physical recovery after hospitalization. Prevention. 1. Vaccination, the most effective measure to prevent COVID-19 infection and reduce the severity of symptoms. 2. Hand hygiene. Regular hand washing with soap or water or using hand sanitizers. 3. Mask. Wearing face mask, especially in crowded or indoor spaces, helps reduce transmission. 4. Social distancing. Maintaining physical distance from others, particularly in high risk areas, to minimize exposure. 5. Quarantine and isolation. Infected individuals or those with potential exposure should follow quarantine and isolation guidelines to prevent the spread of the virus. In conclusion, COVID-19 has had profound impact on global health causing millions of deaths and overwhelming healthcare systems worldwide, while vaccines and treatments have significantly reduced the severity and spread of the disease. Ongoing prevention strategies such as vaccination, mask wearing, and hand hygiene remain essential. The pandemic has also highlighted the importance of psychosocial care as many individuals continue to experience mental health challenges during and after illness. Thank you. Have a nice day.